And we're live here in Nourish, Heal, and Thrive. We have another exciting interview. I have Jen Draper here, and I'm really excited to get to know her and hear all about what she does. So, Jen, thanks for being here.
Thank you for having me, Derek. It's awesome to be here live in Nourish, Heal, and Thrive.
Yeah, yeah. So, tell the group a little bit about yourself. Tell us who you are, where you're from, and what you do.
Sure. Well, I am an ex-medical doctor, and most people who know me first of all as that. However, now I claim the title of holistic healing coach and neurotransformation therapy practitioner and coach and a life coach. So I've studied my master's in life coaching and I'm about to do my master's in neurotransformation therapy and I've completed a master's in neurolinguistic programming. So this is basically a recent career change that happened after I needed to leave my career as an integrative medical doctor, which had been nearly 30 years. So it was
Yeah.
quite a difficult decision that I made. However, what has happened subsequently to that is I've actually allowed myself time to heal. And I've recognized that the best way to live your life is to be able to be authentic in what you're doing, so that what you're doing with yourself is what you're actually doing with your clients. So that's kind of me at the moment, but there's probably a little bit more if you wanted me to elaborate any of those points.
Yeah, I'd love to hear how you got into medicine in general, and then if you're open to talking more about the kind of switch.
Yeah,
Um,
sure, sure,
yeah.
sure. Well, probably when I was a young child, I always seemed to take the role of being the leader amongst my peers. And I can remember playing games with kids in the street, growing up in a sort of suburban town in Australia, as you can hear from my accent. That if we would play doctors and nurses, I was never the nurse, I was always the doctor. And then when I went through school, I found school incredibly boring. And I had a family link there in that my father was a teacher in the school that I moved to, my stepfather actually. And so I was always a little bit of a rebel growing up, which I recognize now comes from the events during my childhood. And I would always be the one who would do exactly the opposite to what was instructed. So, the teachers would say, don't speak out in class. And I would often speak out in class, especially putting my hand up and calling him by his Christian name, which was a no-no, but it was a source of comic relief. And in school, I recognize why I probably did that now with the benefit of hindsight, is that I was bored and I just wasn't challenged sufficiently. And being a comic relief in the class gave me a role to play as opposed to being the straight A student, which I was as well. And I went through school basically playing up in class and then studying at the last minute and then acing all the exams. So when I had completed school and the choice was either to go into medicine or go into teaching, and I had a family of teachers who all basically said, don't become a teacher, become a doctor. I went into med school, and unfortunately, we didn't do too well in med school. I didn't do too well in med school when I hadn't actually learnt the art of studying, and everyone else who came to med school had been top of their classes as well. So that was quite a rude awakening for me. And I did 2 years of med school and got through by the skin of my teeth. So I took a year off, and that gave me some perspective to realize the value of money and being able to apply myself and work appropriately. Then, when I came back for my final 4 years of med school, I did really well and I'd kind of matured and learnt that work ethic. So, as I went through med school and then qualified as a junior doctor, because I had grown up in rural areas, I relocated from the city where I had been studying to rural areas. And by that stage, I was married and I had my first child back in 1998. And she was a cesarean section. And after she was born, We spent a little time in the rural area where she was born, but then we went back to the city because of my husband's work. And then in about 2001, I relocated to a small country town in rural New South Wales, and I have remained there ever since. However, my first husband has since died, and my second husband, with whom I had two boys, we have also separated. And so I'm now currently on my third marriage. So I have three children, and all three of those children were C-sections. And with the second child, I actually went through the process because his preschool teacher had prompted that I went through and got a diagnosis made for him. And lo and behold, he was diagnosed as being on the spectrum, which of course is pretty common these days. And I had also, I'd always been someone as a doctor who had never been into being able to parrot off facts and figures with regards to studies and, this study has shown this, blah, 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 this sort of thing. I had always been someone who I wanted to have a comprehension of why things would happen. And so it was really very sort of hitting me in the face that here I was with three children who'd I'd had C-sections with, and they had had early exposure to antibiotics. And it sort of hit to me that there was something about my children's behavior and my behavior growing up that had to do with the environmental exposures. So, in about the mid 2000s, I I was notified that there was going to be a talk in our local area where a lady by the name of Sue Dengate was coming to talk. And it was at one of the local RSLs, which is a Return Service League club in Australia. These are places where people congregate and we often have talks and things. So I went along to her talk, and her talk was called Fed Up with Children's Behaviour.
Hmm.
And she was highlighting the link between the increasing changes in children's behavior and the way that our foods had changed over the years, and in particular, the addition of or the aging of meats and the production of amines and the additions of flavor enhancers with these numbers, which would be classified, and how children's behavior could change if you actually removed these large food groups. And those food groups were called amines and salicylates. And so I had always been someone who, when I learned some knowledge and I was there working as a doctor, that I couldn't keep it to myself. I always wanted to share it with my patients. And I was very much into self-experimentation with myself and my children, and also with my patients. And so, after I'd been sharing these concepts with my patients, one of my patients came to me, having by this stage, we're into the instant information age, and she had done a Google search as to why would people be intolerant to amines and salicylates, because she had implemented the changes, and her health problem that she had had for 30 years previously, which was an itchy anus, had miraculously gone away within 3 days of changing her diet. So she came back to me and she asked me if I had heard of pyroluria. So I don't know if you've heard of pyroluria.
No, I have not.
Well, pyroluria, when you put it into the instant information age and do a Google search or Wikipedia, it comes up with an entry that it is a pseudoscience.
No.
And so I'm very much into things that are labeled as pseudosciences because for me, we're really talking about getting to the underlying mechanisms behind things. And so the awareness of pyroluria led me to looking into a study called nutrient therapy for mental health. And I actually invested in myself because, of course, to maintain your registration as a doctor in Australia, you need to have a certain number of points each year. And if you uh, choose to just accept the education that is an offer, you will get it for free. Whereas if you choose to learn about areas that aren't provided for free, then you are not going to be exposed to the big pharma funded education, which is provided for free. So I paid to go along several years in a row to a group of doctors who came out from America and taught Australian doctors about this concept of pyroluria. And so that was at the point where I was practicing as a conventional doctor, but learning about all of these things, which included Pfeiffer's Law, which is that for every synthetic or drug substance that influences your mental health, there are natural substances that will produce the same thing without side effects. So that got me very curious and it sent me down the path of learning how to provide prescriptions for vitamins for patients so that their mental health was affected by just taking vitamins. And I went along that pathway once again, doing self experimentation on both myself and my children, and found a very good shift and an improvement in our mental health and physical symptoms as well. However, the one thing that I noticed was I was on these big, big bottles of very smelly vitamins that I would take multiples of capsules each day. And it became such that I would have to eat to take the capsules. So, and if I accidentally missed a dose, especially if I missed two consecutive doses, I would notice that my mental health would plummet the next day and I would be very teary and emotional.
Mm.
So I kind of thought to myself that, well, what's the difference between me being dependent upon these synthetic vitamins versus taking my previously prescribed sertraline and other things that conventional doctors have prescribed for me. So I was feeling a little uncomfortable with this, but at this time I was uh, running a practice and I had a team of people working with me, including this amazing nutritionist. And every year, because I was a solo general practitioner, we would close for 2 or 3 weeks. And one year, this lovely nutritionist came back and presented to me, "Have you ever heard about the root cause protocol?" And I'm like, "No, what? Tell me about it." And in a nutshell, what it was this freely available protocol, which was, I call it a download received by a chap by the name of Maureen Robbins. And he basically was an epidemiologist who had founded a Facebook group called the Magnesium Advocacy Group, much like your group, Derek, starting out small and attracting people through the laws of attraction, and people recognizing that magnesium is one of the key trace elements for normal functioning for all of the body's enzymatic processes. And the reason why is because magnesium is a cofactor for the production of energy. And so each time when our body is using energy for all of its processes, it's depleting its magnesium. And you might say, oh, well, I'll just take magnesium and I'll be fine. But not all magnesiums are created equal. And in fact, if you go to your supermarket and purchase magnesium, you will get magnesium oxide, which is a wonderful laxative. But most people don't need that.
Right.
So anyway, I read this protocol and watched his videos, and I went from taking 14 capsules of very smelly prescribed synthetic medicine, and I went through his stops, which was stop all multivitamins, stop all iron, stop all vitamin D orally, and start taking instead only food sources of things. And I transformed within a couple of weeks and felt amazing, both in terms of my mental and physical health. And I was saving an awful lot of money because I wasn't spending, $400 or $500 every few months on my prescription for nutrients.
Right.
The compounding pharmacists weren't very pleased, but I felt so much better. And so I was also, of course, I started to share that with my patients because they could go through the videos, much like I had done, and they could actually start to heal themselves without being dependent upon these synthetic supplements. And I don't know if you want, I can go later on into the theory behind the root cause protocol because I'm
No,
sure
but
that
I'd love to hear more about your transformation that you went
yeah,
through.
yeah. So that was the first step in my transformation. And by this stage, we were getting to around about 2019. And obviously, 2019 is quite a turning point for many people who are aware of, and even not aware of doctors in the medical field. But at around about that time, there was an announcement by the regulatory bodies in Australia that they were going to consider one set of rules for doctors who played by the rules and did all of the conventional stuff, and another set of rules for the doctors who were complementary. Friendly, integrative doctors, like I was by that stage. I was certified in anti-aging medicine, and that prompted me to look at alternatives to actually being a doctor because I didn't like the concept of one set of rules for when we'd all done the same study and the integrative doctors had actually self-funded their additional study into areas which were not necessarily condoned by the mainstream. So I looked into my alternatives, and one of the things that really attracted me was the concept that rather than being locked in my consult room with a one-on-one, that I might possibly be able to speak one to many. So I started training as a coach, and I started and enrolled with a woman over in the States who I would get up early for early morning meetings and do my meetings in this group, learning about how practitioners could convert their one-to-one into one-to-many. And during on one of those early morning meetings, I connected with a ex-doctor from Canada who started madly messaging me in the chat as we were talking online. And he became one of my really good friends who I'm still speaking with regularly every day to this day. Every week, sorry. We have a regular session, which has worked out really well. Now, around about the same time when I was looking into alternatives, looking at how I would fund my coaching, and I was in the position where I had this big building that I'd only developed half of for a medical center, and there was another half of it that we being myself and my partner at the time, who's now my husband, came up with the idea that we could make a wellness center, but we needed to fund it. So we started, the initial concept that we had was we would look at hyperbaric oxygen therapy. And when we did our research, we realized that hyperbaric oxygen therapy is quite an expensive process and very promoting of anti-aging and longevity. But it works best for people when they're in a state of nutritional ketosis.
Mm.
And I had already been experimenting with nutritional ketosis, and I'd had very dramatic weight shifts. And I then started down the process of investigating network marketing. However, being a high achiever, I didn't just do one network marketing, I did five. And as well as that, I also had all five of these network marketings off my separate website to my medical clinic. And I also trained in intravenous vitamin therapy for along the lines of the nutrient therapy for mental health, but more so for supportive therapies for people who were going through things like cancer journeys or who were just aware that if they had a massive, massive infusion of vitamin C, they could get their blood levels of antioxidants up way higher than you ever could taking things orally. So I kept my website up, and my website was like a yum cha, smorgasbord of all of these different things I was doing. And I was quite actively doing network marketing for about a year. So at least once a week, I would get online and teach about these energy devices and things that I was using as well, self-experimentation, and really enjoying. Teach to the masses, not to my patient population, teach to the masses. And I all of a sudden had like three people approach me and say, be really careful, there's something big going down. And all of a sudden, in the space of a day, I decided stopping that.
Yeah.
But I kept the website up because it was where people would book for the intravenous vitamin therapies. And so I just went back to being the doctor. And of course, it was 2020 and 2021. And you know what else was going on around the world at
Right.
that point in time. And I was being small and not going online, not doing any social media. I actually shut down my Facebook account and just completely closed in and just was focusing on trying to get by in the everyday thing, which was people coming in and they were seeking me out, but I couldn't actually see anyone new because the system that I had set up, I was so busy with the patient population that I had, my books had been closed. Are you familiar with what that expression means
Yeah,
for a
yeah,
clinician? Yeah.
sure.
I wasn't taking on anyone new. I was just dealing with those people that I had known for many, many years, and they were coming regularly and having their program visits, and I was helping them to deal with the day-to-day issues and their chronic management conditions. And then that whole madness thing was up, and I still had the app on my phone, and it just started pinging like crazy. Like lots and lots of pings saying someone was visiting my website. And then all of a sudden, I got a message on this is just before I shut down my social media. Uh, Healy, sign me up, which is one of these energy devices. And I looked on the Facebook profile of the guy who had sent me this message, and he was an anti-vaxxer. So anti-vaxxer nowadays has got way different connotations to what it had way back in that time. And this guy was really dumping shit on people who were saying, you can't do this. And anyway, I just went block instantly, shut down my whole Facebook profile. And then, sure enough, 2 weeks later, a complaint came through. And the complaint came through that said, surely this doctor who has been doing network marketing has got this website, lots and lots of screenshots, hence all the pings on my little website app,
Mm,
and this other website. So we had this one business here and one business here that were operating simultaneously. And surely this doctor needs their practice put under the microscope because you can't be a conventional doctor as well as doing network marketing. And I did not recognize that the way that I had separated things out was inadequate for the regulatory bodies to see there as being a differential. They
mm,
were thinking that I was network marketing to my patients, which I was very, very careful to keep the two separate. And part of the reason why the website had kept up was because that intravenous vitamin service that I provided in my rural town, people would have to travel hours and hours away to get anywhere else. So in my lunch break, I would, be infusing people with vitamins in between my busy clinic sessions. So I kind of kept going like that until all of a sudden I had to bring it to a grinding stop because that just sort of shattered my world because I had up until that point been a bit of a rule pusher, not so much like the rebel that I was way back in school time, but I was starting to think that maybe there was a bigger agenda.
okay.
And I was starting to scratch the surface that, yeah, there was just a different thing going on at play. And maybe I was actually being complicit with, at the same time, being unaware. And from that point onwards, my whole kind of ability to just be open, transparent, and out there on social media. Once I had received that advice from that lawyer that as a registered doctor in Australia, you realize you cannot do anything else except for being a registered doctor.
Mm,
That led me to ask, why not? And how could you? And so I started investigating different kinds of ways to operate outside that regulatory system. And in the end, that kind of screwed with my brain a little bit, so much so that it was very difficult to be confronted with what was going on externally in the society and the expectations that were being placed upon people. And people were just complying, thinking that they had no choice. And I recognized that, well, there has to be a choice, and I need to look internally rather than looking externally to work out where that choice was.
nice.
And I found that choice for me came from working with coaches who caused me to look within myself and really identify with what my values were. And I recognized that by just providing that support of keeping people in their comfort zones and giving them their prescriptions and giving them their cancer screening and giving them their chronic disease management and fulfilling the expectations that the medical juggernaut was imposing upon me as a registered general practitioner, I wasn't being true to my own values.
Mm,
And yeah, that was a difficult time for me, mm, because Yeah, it was an awful long time, nearly 30 years. So, I still have a little bit of grief when I think about that time. Um, just because I really had thought I was helping people, but I now realize that I was keeping them in loop of dependency. So, yeah, so I appreciate it for the lessons that it gave me, but I I've kind of got some misgivings that people so easily give up their power to a trusted health professional. And once I had lost that trust in the system that had trained me, and I saw through what was actually happening, I just couldn't, in all good conscience, stay in it.
Yeah.
Yeah. So that's kind of my story. And I apologize if my tears make anybody feel uncomfortable because they don't make me feel uncomfortable. I think
No.
it's a really important thing for people to recognize that the stored emotion that they have within themselves, if they just keep putting their lid on it, then it builds up like a volcano that's about to explode. And for me, in those last few months before I eventually just closed the doors on my medical business, I would regularly shed my tears in the consultation with my patients. And if I wasn't shedding my tears, then I was snapping at them. So my emotions were very raw and very much on display, which I recognize was not what was expected in a health professional. And I actually had a registrar doctor who was very rigid and like a robot, and I would often express tears to him, and I could tell he was feeling incredibly uncomfortable. And I asked him, what are you taught in med school? Are you taught that you must be like a robot and not show your humanity? And he's like, yes. So yeah, that was kind of the tipping point for me to recognize that if I wanted to be able to just be a woman, then I needed to step down from that pedestal that people were artificially elevating me to and let them just see me as a woman who has her struggles and recognizes that, yeah, there's a whole heap of knowledge in this brain, but how much of it is actually based upon reality versus indoctrination?
Yeah.
Yeah. So it was a real
Yeah.
questioning moment for me.
Yeah. It's quite a journey and really appreciate your vulnerability and just sharing. So tell us how you help. We were kind of running out of time, but I want you to tell us how do you help people now, like who
Well,
your
now I
clients
help
are.
people by letting them know that part of where I've come from and recognizing that in coaching they need to look within. And
Mhm.
what I do is I use neurotransformation therapy. So this has been a modality of neurolinguistic programming, kind of on steroids, synthesized down to really confronting the bullshit stories that we tell ourselves and acknowledging that we have the power within to heal ourselves. I also draw upon human design, but more so as a conversation starter
I see. Yeah.
because in the words, it actually tells us what we are doing. We are human by design. Well, that's one way of looking at it. So, but when I coach people, I help them to acknowledge those emotions and then release them from being stored within their body so that they can then really connect with what their values are truly and rewrite using subconscious reprogramming. And so I work one on one at the moment, but when I complete my master's, which will be at the end of November, I'll be starting group programs. And I also like to work with couples because connecting in your relationship with yourself and then extending that to your relationship with your significant other provides so much joy in life.
Yeah.
Yeah.
Yeah, because we're always co-creating, right? So we,
Exactly.
yeah,
Yeah, you can't do it on your own.
yeah,
Yeah, you community is the secret, and having people who come together with the law of attraction in action. You cannot be. I recognized from the beginning I couldn't be the doctor for everyone. I was very polarizing. I didn't like to shut my mouth if I had an opinion on something. Nowadays, I say opinions are like assholes. We've all got one.
right.
So I draw upon my lived experience, and that makes way more sense to me than something that's written in a textbook or that I've learnt at some course. Or yeah, my lived experience I value so much more,
Yeah,
and the people that I connect with just through that law of attraction in action.
nice. Is
Mm.
there anything that you want to talk about that we
No,
didn't
I
get a
think
chance
that's
to talk?
probably enough. I think that, I'm now recognizing that I can make a much bigger contribution to the world
Yeah,
by owning the fact that, yeah, that was a painful story that I went through, but it's helped me to grow as a woman and not as a person. I don't like that word. That is a role that we can choose to play or not. But as women and men on this earth in this lifetime, we have an amazing ability to impact so many people just through the energy that we put out. And I don't like reliving that story, but I was quite happy to do that for this recording, just
nice.
so that even for my own enlightenment to recognize where I have come from, I am really proud of myself now.
Yeah,
I'm proud to be living my truth.
great. Amazing.
Yeah. Thank you so much for letting
Yeah.
me share, Derek. I
Yeah,
really
how
appreciate it.
does my group get a hold of you? How do people find you or connect with
So
you?
I have a website, wellbeingholistic.net, and if you check out my Facebook profile, there's a booking link. Everyone starts off with a free 40-minute quantum call. And if they do want to access their human design, then they can just message me human design and book a quantum call, and I can share their chart link with them, and we can start there as a point in conversation. Although we go a lot deeper with the neurotransformation therapy.
Sure, great. So
Yeah,
we're gonna have you leave your links in the comments here of this post.
sounds great.
You can just click on it.
Awesome.
And we really appreciate you doing this. Any words you want to leave everyone with?
No, I just want to say thank you so much for listening. And I hope that I didn't cause you too much discomfort with my tears
Yeah,
and feeling tears and feeling emotions and letting them wash over you. Just think about being a little pebble on a beach.
yeah, I'm feeling
Yeah.
it. Yeah, it's coming. It's
Very
coming.
good. Thank you so much.
Thank you so much, Jen. Thanks everybody for watching. If you resonate with Jen, then click on her links that she's going to leave here below and you'll connect with her and she'll give you, what was the 40-minute session?
Yeah, free 40-minute quantum call.
Okay. And yeah, if you like what we're doing here in Nourish, Heal, and Thrive, just comment interview and we'll spotlight you and let you share your gifts. And even if you're struggling, we'll give you the support you need to. So thanks again, and we'll see you at the next one.